So for breast reconstruction, this can be done at the same time as the mastectomy or at a later date. 6 to 8 weeks that it takes to be fully expanded. What is put in there is saline expanders, and so the client goes in once a week and has more saline instilled, and then it just expands the skin more and more until they can get it far enough to be able to put in a implant. Reconstruction can also be done with tissue removed from another part of the body. This is called autologous reconstruction. So often it's skin, muscle, and fat can come from the lower abdomen, back, and buttocks. A lot of women do like this better because it appears more natural. And insurance will pay for the breast tissue to look symmetric. And so they, if they have to do, anything to both sides, they will do that. So some women do, maybe they might even get a breast reduction out of this. The nipple is created from other tissue in the body, like inner thigh, and the labia is used as well. Remember, teaching needs to be done for the patient to let them know that nipple will not have any nerve endings, so it is less sensitive than it was before. What's new? The sister study will look at causes and follow 50,000 women whose sisters have had breast cancer. More studies of medications such as tamoxifen and raloxifene. The MRI and breast biopsy, a new biopsy method that uses MRI to obtain samples through one small incision. There is a new class of drugs that targets cancers with positive BRCA gene, so that's something new. 3D mammograms are being offered as far as imaging for detection in certain places. Sanford is doing this. And then we also are looking at accelerated radiation, where they get higher amounts of radiation and faster, so that they don't have to go as often. With reconstruction, skin-sparing mastectomy is a new procedure that works as well as a modified radical mastectomy, and then results in less scar tissue and a more natural-looking breast. It's important to remember that research has shown that people with breast implants do not have any greater risk of immune system disease. There is some myths out there that people think that with breast implants that you're going to have more incidence of like lupus and things, but that has not been shown to be true. Also, breast implants do not show any increased risk of breast cancer coming back or new disease forming. So people can be assured that the implants are safe. So the last thing is just that research is using advanced ways of finding patterns of genes and then also suggested new ways of classifying breast cancers. Current types of breast cancer are based on how the tumors look under a microscope, and this new system would look at more molecular features and be able to better predict the outlook for that patient, and then respond to and the response to different types of breast cancer treatment. You're seeing this it's the human genome, and they're looking at this with other areas as well. Mitchell has just gotten approved with Avera to do a study with Core Orthopedics in Sioux Falls. This is a similar thing to this, and it's predicting how they will do some blood draws on people that are getting orthopedic procedures and be able to look at how their liver is metabolizing pain medicine, so they can tailor the pain regimen to that individual person. So it's exciting stuff with the Human Genome Project and different things that they're going to be doing with that. Some good websites are the Komen.org website. There's lots of good videos there and good information, and then cancer.gov, and you can also look under American Cancer Society.